Hello, my name is Shayla Gage, and I am a Year 2 pharmacy student here at the Ben and Métis Fish College of Pharmacy. This is a patient information video on Molnupiravir. Molnupiravir is currently unavailable in a generic name in the United States, but it is available as 4 oral capsules. Why am I taking this medication? Molnupiravir is an antiviral medication that has been issued as an emergency use authorization for the treatment of mild to moderate COVID-19 in adults who have a positive COVID-19 result, those who are at high risk for progression to severe COVID-19, including hospitalization or death, for whom other treatment options approved or authorized for use by the FDA are not accessible or clinically appropriate. Do not use Molnupiravir if you are less than 18 years of age, for the prevention of COVID-19, if you need hospitalization for COVID-19, or for use longer than 5 consecutive days. How should I use this medication? Molnupiravir should be taken as 4 capsules every 12 hours for 5 days. Do not stop taking this medication before the full course of therapy is complete, even if your symptoms resolve. Take with or without food, while making sure to swallow whole without opening, breaking, or crushing the tablets. Remain in isolation for as long as your healthcare provider tells you. What if I miss a dose? If it has been less than 10 hours since the missed dose, take it as soon as you remember. If it has been more than 10 hours since the missed dose, skip the missed dose and take your next scheduled dose. Do not double the dose of Molnupiravir to make up for a missed dose. If you have trouble remembering your doses, keep an alarm on your phone or leave yourself notes to remember. What side effects can occur? Molnupiravir can cause diarrhea, nausea, or dizziness. Any signs of allergic reactions should be reported to your healthcare provider right away. This includes signs of hives or skin rash, swelling of the face, difficulty swallowing or breathing, or hoarseness. What should I tell my healthcare provider before taking this medication? Tell your healthcare provider if you are taking any medications, including prescription, over-the-counter, vitamins, or herbal products. If you have any allergies, are breastfeeding or planning to breastfeed, or have any serious illnesses, alert your healthcare provider as well. Molnupiravir has not been studied in pregnancy. Therefore, it is not recommended for use in pregnancy. For those who are able to become pregnant, use a reliable method of birth control consistently and correctly during treatment and for 4 days after the last dose of Molnupiravir. If you have trouble remembering your medications, keep a list of them to show your healthcare provider and pharmacist when you're receiving a new medication. It is also advised that you take a pregnancy test prior to drug therapy. Where should I store my medication? Store Molnupiravir at room temperature in a dry place. Do not store in the bathroom. Keep all drugs in a safe place, away from children or pets. Dispose of unused or expired drugs while making sure to not flush them down the toilet or pour down the drain unless you were instructed to do so. Always consult your pharmacist if you are unsure of how to properly dispose of a medication. If you have issues remembering where to dispose of your medication, there may be a drug take-back program within your local area. Now it's your turn. Here's a scenario. Yesterday, you took your first dose at 7 a.m. following your second dose at 7 p.m. Today, you took your first dose at 7 a.m. again, but after a late night shift at work, you went straight to bed, skipping your second dose. On the following day, you are about to administer your first daily dose at 7 a.m. as usual, realizing that your second dose from yesterday was never taken. Do you take 2 doses at the same time to make up for the one you missed yesterday? Or do you skip the missed dose and continue your normal regimen? I think you've got it. Since it has been more than 10 hours, you want to make sure that you skip your missed dose and continue your normal regimen. Never double up on your doses. Set reminders on your phone within your calendar. Incorporate taking pills with your daily routine. Example, for in the morning, if you take your first cup of coffee or when you brush your teeth, you can take your first dose. Or for your evening doses, take right before eating dinner or when doing nightly hygienic routines. Incorporation into your daily activities will decrease your chance of missing a dose. Thank you for watching.